And I'm pleased to report we're testing more than 100,000 people a day now. But we're working around the clock to scale up the new types of tests that the FDA has approved in record time. And every American can be confident that we'll continue to build out that structure going forward for the weeks ahead and the months ahead. At the present moment, there's more than 450,000 Americans who have tested positive for the coronavirus, and sadly more than 16,000 Americans have lost their lives. And as President Trump just said, our hearts go out to the families that have lost loved ones. And I want to assure you that all of us working at every level understand these are not numbers, these are lives. And our heartfelt condolences during this heartbreaking week go out to every American family that's lost a loved one to the coronavirus. It has been a difficult week. But as Dr. Birx will reflect in just a few moments, as we look at the data literally on a county-by-county basis every day, we continue to see evidence that in areas where the epidemic has impacted most, the greater New York City area, Louisiana, the Detroit metro, the Denver metro, we continue to see evidence of stabilization. And it appears, as Dr. Birx suggests, that we are close to the peak in each of those areas so impacted. We also express gratitude and appreciation for the people of California and Washington State, who continue to be low and steady in the number of cases that are emerging there. We're watching the Chicago metro area, we're watching the Boston metro area, and as Dr. Birx will discuss, we just continue to urge every American to put into practice the President's coronavirus guidelines, because all evidence indicates from the West Coast to what we're beginning to see in major outbreak areas on the East Coast. It's working, America, and it's working because you're doing it, and we encourage you onward in that. Today, the White House Coronavirus Task Force met, but most of the team also met with Republicans and Democrats in two separate conference calls of the United States Senate. Secretary Mnuchin, our health experts, Admiral Polovchek, Dr. Hahn joined us as we discussed a broad range of issues. The Treasury Secretary touched on the Paycheck Protection Program, now in day 5, reporting $125 billion has been approved so far. 30,000 new individual users and 3,900 lenders are participating. We also discussed that the Treasury Department will issue a new frequently asked question document tonight, an FAQ as they're known, to clarify how seasonal businesses can participate in the Paycheck Protection Program as well. With regard to direct payments to Americans, the Treasury Secretary assured senators, and we assure every American, that we remain on the timetable where the first payments in direct deposits will go out by the end of next week. For the average family of 4, that'll be $3,400 in direct financial support, and will no doubt be welcome news. Anyone who is interested in additional information on any of these programs can go to treasury.gov or sba.gov. Since we last spoke, I spoke with Governor Laura Kelly of Kansas, Governor Andy Beshear of Kentucky. I also spoke to governors of Texas and Rhode Island. I assured each one of them, as we continue to work through the process of making sure that we distribute the resources at the point of the need, is that at President Trump's direction, our objective working through FEMA is to make sure that states have what they need when they need it. And to see the progress that we've made, the President just reflected on in New York and New Jersey, Louisiana, and the partnership we forged with governors in those states, California and Washington State before. We trust gives confidence to governors and leaders of states across the country, and most importantly, our dedicated healthcare workers, that we will be there to meet that need should that need arise. At the present moment, FEMA reports the President has approved 54 major disaster declarations. And states around the country have stood up 29,000 National Guard, 11,000 of which are fully funded by the federal government under Title 32. Also, speaking of our military, at the present moment, we received a report today from the Department of Defense that 4,100 active duty military medical personnel have been deployed in New York, New Jersey, and Connecticut. And they are personnel that are working on the ground at the Javits Center, working, of course, at the USNS Comfort ship. But because at the present moment, the utilization of both of those temporary facilities has been fairly modest. The DOD actually worked with the city of New York to establish what amounts to a uniform temp service. They call it the bullpen. And today they literally deployed from the ship and from the Javits Center 75 medical personnel to relieve dedicated healthcare workers within the hospital system in the city of New York, and we'll continue to do that. We're going to make sure those federal temporary hospital and Javits Center is fully staffed. We'll make sure the USNS Comfort is staffed, but the physicians, those military personnel, are going to also be deployed across the city to bring much-needed relief to our healthcare workers in our system. From the VA standpoint, we've opened up VA facilities in New York City, East Orange, New Jersey, Detroit, Michigan, and we are opening up the VA facility to coronavirus patients in Shreveport, Louisiana. Finally, I mentioned that today we exceeded more than 2 million tests that have been performed across the country. And also, literally, working with the U.S. Public Health Service, states around the country have stood up hundreds of drive-through testing sites. And just this week, FEMA and the U.S. Public Health Service announced that we will give an option to states to transition from a federal testing site, dozens of which have been assembled around the country, to a state-managed site. I want to emphasize that this is an option. We believe it gives states greater flexibility to style sites or manage sites in areas that they think are most important. But we're also processing requests for continued federal participation in states from New Jersey to Louisiana to Illinois, Colorado, and Texas. And we want to assure people in communities all across the country that we'll continue to partner with states to the extent that they prefer us to be a part of it. With regard to the air bridge, 3 flights were scheduled to arrive today in Chicago, New York, and Dallas-Fort Worth. 49 flights are scheduled over the next 3 days. And we continue to work supplies. We continue to literally leave no stone unturned around America and around the world. We're literally in the process of acquiring tens of millions of supplies that are being brought into a distribution system organized out of FEMA and focused on the areas most in need. We're also bringing real innovation, and at the White House Coronavirus Task Force today, we tasked the FDA and CMS to review the feasibility of allowing hospital workers to use cloth gowns for performing procedures. It was observed that 20 years ago, most physicians and most surgeons wore cloth gowns every day and laundered them, but it's transitioned to disposable gowns. And we're working very rapidly in the next 24 hours, and we'll have guidance for hospitals and healthcare workers about the ability to in effect, recycle gowns and make sure that we have the supplies that we need. As the President mentioned today, the President and the First Lady and I and my wife, Karen, were honored to be a part of a conference call with mental health professionals from all around the country. And we know while there are families that are struggling with the coronavirus and struggling with heartbreaking loss to the coronavirus, we understand this is a very challenging time for every American, but most especially Americans who struggle with mental disorders or struggle with addiction. And the President brought some incredibly dedicated people together to make sure that they know we're with them. Early on, the President expanded access to telemedicine. And we've also issued guidance for using technology to remain connected to social support groups. And we just urge everyone who may be feeling an emotional burden or a vulnerability during this time to reach out to the many resources that are there, and to know that you're not alone, that we're with you, and we'll get through this, and we'll get through this together. So despite heartbreaking losses that continue this week in communities from New York to New Jersey to Louisiana, there are signs of progress, and hope abounds. The reality is that we see new projections from the experts. And if the projections are right, it's because it's working, America. It's because the American people are putting into practice the social distancing, caring for their neighbors and their loved ones and their family members, and putting their health first. And we just want to urge every American to continue to put those principles and guidelines into practice every day. With that, I'm going to invite Dr. Deborah Birx up for an update. And Dr. Fauci will hear from the Secretary of Labor, and we'll take a few questions.
Thank you, Mr. Vice President. So I wanted to cover today not only what we're seeing across the United States, but some of the testing data to assure from the prior question, if we're testing, I'm sure you're following our numbers every day, and the amount we're going up, about 118,000 to 120,000 per day are being tested. So we're way over the 750,000 per week currently. We have some statistics. Now, remember, we required this, thanks to Congress, to be reported. We have about 75% of that test data in now. About 1.5 million of those tests have been reported in. I just wanted to give you some ideas, because sometimes we think that we're only testing in the hospitals, so this should give you an idea of the quantity and the types of tests that have occurred. So we've tested over 200,000 young people up to age 25. They have about 11% positivity rate.